There was a political context at work here, too. There was a shift in the country's mood. The great experiments of the 1960s showed disappointing results. The Vietnam War produced a crop of 50,000 dead. The Great Society of Lyndon Baines Johnson had limited results. Poverty and inequality remained. Faith in the solutions of big government was waning by the early 1980s, and many now turned to free markets and a reduction in government participation. Margaret Thatcher in Great Britain and Ronald Reagan came to power in the early 1980s. And in the U.S., the mandate to cut taxes and reduce the size of government was clear. Such attitudes had a political expression as well. Jesse Helms, the senator from North Carolina, in 1987 spoke out against a brochure describing a gay sexual encounter that he had received some federal funding. Helms pushed for a ban on any federal funding on any AIDS educational material that promotes or encourages homosexual sexual activities. Some congressmen actively fought to defeat federal budget outlays for AIDS research and prevention. William Dannemeyer of California, on the floor of Congress, stated, "God's plan for man was Adam and Eve, not Adam and Steve." By 1985, pressure was mounting. Reagan had not yet said anything about AIDS, and that year he made clear in a press conference that AIDS might be transmitted by casual contact. The Center for Disease Control responded immediately and violently, stating emphatically that AIDS was a blood-borne disease and could not be transmitted casually. At the same time, the CDC, a government agency, had its funding cut. All of this makes for interesting contrast to the public response to an earlier epidemic, polio. In the 1890s, polio was identified, and by the early 20th century, improved public hygiene and sanitation in the U.S. meant people were exposed as young adults, often from higher socioeconomic classes. Because those affected were higher in social status, society responded with great vigor, with highly visible national crusades such as the March of Dimes. So the nature of victims was directly related to how the public understood the disease. Interesting to note that 50,000 died from polio between 1900 and 1950, fewer than were killed by AIDS in the 10 years between 81 and 91. What was the effect on AIDS victims? Many were losing housing, losing jobs, being denied health benefits, and the victims also had to fight the bureaucracy of disability. Gay leaders responded. In 1987, thousands contributed to the AIDS quilt on display on the Mall in Washington, D.C. By then, though, more than 40,000 had died. Cleve Jones, a gay leader, his idea for the quilt was a stroke of genius. The quilt as a warm, comforting, middle-class item and idea to draw middle-class support to this extraordinary catastrophe. Support did come, though. Reagan was president for the AIDS first decade. He gave only one speech on the subject and stayed generally aloof from the subject. He was clearly distant from the epidemic, and many, especially in the gay community, were vocal in their criticism. Yet in spite of the backlash and cuts elsewhere, funding for AIDS research was robust. Fundings were increased for research, education, and drug treatment every year between 1981 and 2005. Margaret Heckler, the HEW secretary, evinced public sympathy and came to the bedside of an AIDS victim in New York City. The Public Health Service AIDS resources grew from $5.5 million in 82 to $204 million in 86. Additional money was pledged to the CDC, the FDA, and the Mental Health Administration. By 1990, the Public Health Service budget devoted to AIDS was about $900 million. As early as 1983, the Public Health Service identified AIDS as the #1 priority. $15 million was earmarked for AIDS research. Lucrative NIH grants to AIDS labs from early on defined this period as well. In 1986, at a Public Health Service retreat, 85 experts developed progressive recommendations: education, voluntary testing, research, drug treatment, vaccine development. And in 1990, the House approved a bill for comprehensive care of AIDS patients. at the cost of $4 billion, the Ryan White Care Act. But in spite of all these substantial efforts, by 1992, when Clinton was elected, AIDS had already killed 200,000 Americans and another 1.5 million were infected.